Well, Lean, is a process improvement methodology used by Toyota to improve throughput and process on an assembly line. For the emergency department, while we're not an assembly line, we do have a lot of process that lends itself to Lean process improvement. So we have looked at a number of processes within our department, door to dock being one, try to get the physician in front of the provider quicker, admissions out of the department, laboratory result turnaround times, and have been very successful in adopting those process improvement strategies to the emergency department. We track our improvement on a board like this called a MDI board, which is Management for Daily Improvement. And we track all of our rapid improvement events, which are the specific events that we work on a specific process. A rapid improvement event lasts a week. It's all day long, all 5 days, with understanding that at the beginning of the week you start off with the problem you want to solve, and then by the 5th day of the week you actually have implemented solutions into the workplace. On our MDI board, we have our first rapid improvement event, which was focused on left without being seen reduction and improving our door-to-dock times. We improved our door-to-dock times from over an hour to less than 30 minutes. Our left without being seen went from 3 or 4% to down to almost 1%. So both of those metrics, that was a wildly successful project. Our second improvement event focused on laboratory turnaround times. And at Columbus Regional, we were very proud of the fact that our laboratory turnaround times were very good before the improvement project, and we were still able to improve them about 25%, which was really a top box for a hospital of our size. Our third event was on admits out of the ED, and we've been able to take from the time that a physician makes a decision to admit to the time the patient gets into bed. Pre-event was taking us about 4 hours. Now we're down to about 2 hours and 35 minutes, which is a significant improvement that comes directly off the length of stay for an admitted patient. Our fourth event was on the direct admit process, which really bypasses the emergency department, but if it doesn't work well, then they end up being diverted to the emergency department. And we've been able to, this process is still in the works, so the results are still kind of out on it. However, the general consensus is that the process is working better than it's ever worked before. Well, I think that's one incredibly valuable thing about this process is that it drives decision making. It truly drives decision making down to the lowest possible level. So when you have employees who really are the most invested, knowledgeable people about process, making those changes, it automatically facilitates their buy-in on the changes, as opposed to somebody coming in and telling you who doesn't know anything about your business, this is the way you need to be doing it and you need to make changes tomorrow. That doesn't work very well. So what we have discovered through our employee engagement pulse surveys is that our employees feel much more engaged in the operations of their work than they did before the Lean event started. In fact, our score on the last engagement survey was higher than it had ever been. So I think from an employee perspective, this is great, not to mention the fact that it's a great opportunity for staff to be involved in something that really is a resume and skill builder that is easily transferable to other places and other jobs and positions and well for advancement in the system. And it's just, there is no downside to an employee to be involved in one of these events.